All right, good afternoon, everyone. It is 16 minutes after market close today on March the 30th, Tuesday. Thanks, everyone, for joining us. I'm Chris Dobbin, CEO of Nova Leap Health. NLH on the Venture Exchange is kind enough to spend some time with us today telling us about his story. Chris, thanks a lot for joining us. And why don't you spend 5-10 minutes just giving us an overview of Nova Leap and what you guys are up to.
Sure, I'd be happy to. Thanks for having me. I appreciate it. I know you and I met probably for the first time, think back 2 or 3 years ago now. So I know you've been following along with our progress over the last few years. So appreciate the opportunity to speak to you today, plus your audience. Maybe I'll just give a brief overview of the company in terms of how we started, then just roll into what we've been doing over the last, I guess 3.5 years or so. So a number of years ago, my father-in-law was diagnosed with Parkinson's. Last couple of years of his life, my mother-in-law had home care for him, really for 2 reasons. One, because it was a difficult situation for her, so she needed respite. We call giving somebody a break, just given the circumstances. And two, really he needed quite a bit of assistance, and had deteriorated quite a bit over a period of time. A super guy, but needed quite a bit of help within the home. So our family's first experience with home care, and we saw the good and the bad. The bad, maybe not, having properly trained people initially, and then the good, really nice people that come into the home and provide the care. But again, there was this gap in terms of, very nice people, but maybe not necessarily being trained properly to deal with somebody who has dementia. And so it would have been 9 or 10 months after he passed away, and my wife and I saw an opportunity to acquire a home care based business. We bought that business, and we went from this family experience to really providing care to about 140 families along the northern corridor here in Nova Scotia. Saw what we thought was a pretty significant opportunity as we looked at the market in Canada and US in particular. Really fragmented market, thousands of these mom and pop independent home care agencies around. And so I thought from a business perspective, there was a fairly significant opportunity. And so back in 2016, we went through the CPC program. And so we started a clean shell. And so we didn't do the traditional sort of RTOs thing. We seeded our own shell, went through a very, probably did the smallest qualifying transaction in the history of the exchange, I think. I believe it is. Did a tiny.
That was just a couple of $100,000, wasn't it?
I think it was what was it, $240,000 or something? It was really small. I do think it was the smallest based on what we'd heard at that time. And then we did a really small IPO. But we were able to get through that process in 2016, and so we went from qualifying the CBC status to a fully listed venture exchange company. And then it was really through the latter part of 2017, really since September of 2017, we've been really active. I think we've completed in the 3.5 years, 13 acquisitions have closed. We have a 14th that's currently undergoing a licensing process, which we'd announced actually last September. So it's a New England-based company that, again, this particular licensing process is taking quite some time. But we've been rolling up these smaller home care agencies, really good agencies. Usually the owner's looking for a succession plan, so somebody looking for retirement. And what we identify is somebody within the operating team, so somebody within the office that can elevate themselves to a greater leadership position, if you will. And that person runs the office, usually has 2 or 3 staff within the office itself. And then there's probably 70 or 75 caregivers out in the field, usually in people's homes. So the nature of the work we do is traditionally non-medical. Dementia care certainly leads the list. Medication reminders, transportation errands, physician visits, personal grooming, mobility issues, getting out of bed, things of that nature. Again, primarily on the non-medical side. And then we would do some medical work in terms of IV push, med pores, things of that nature, palliative care in particular. So that's a bit of the business. Certainly that's the background in terms of how it started, coming from a personal situation, identifying, I thought, what was a fairly significant opportunity. I think we've grown, pretty significantly certainly from a percentage and dollar perspective over the last couple of years. And from my perspective, we're just getting started. The vision I had for the company, back in 2016 is the same vision as today. I mean, I think there's a significant opportunity for us. We've been, fairly picky with the companies we acquired. Again, they've been on the smaller end of things for sure, but we think those are good businesses to buy, and so we continue to look at those.
All right, great. When you start from your last comment there, so when you say there are smaller ones, is that in the spectrum of the home healthcare industry, or is just generally the industry is populated with all these small companies that could be acquired, or are there some sort of larger and medium-sized operators out there?
Well, I think if you go across the continuum of care, you're going to find different things. So if we're talking home health, and in particular in the US, where you're into Medicare and Medicaid, there's a combination of tiny little businesses all the way to large public companies like LHC Group and Medicis and Addis and so on. In our space, we're looking at the non-franchised independent operators, and they tend to be on the smaller side. Certainly there are larger companies out there, no question about it. We've looked at some. Both, they may be regional players in particular, but there are a lot of these smaller mom and pop shops that generate between $1 million and $5 million of revenue. So again, really small, and those are the ones that we've been going after for the last 3.5 years.
And as you get bigger or get a greater concentration in areas, are you maybe going to go after the bigger ones, or is that just a great spot to be in the market where you pick off these little ones, and as you get bigger scale and bigger staff, you'll be able to have a sort of a faster cadence or rhythm to acquisitions? Because once you're getting to a size where if you buy $1 million company, it still moves the needle a bit, but it's having less impact.
Yeah, so it's both, right? There's a reason why we're buying these smaller businesses, because we think we can get good return on the capital. I mean, if you look at how we've deployed our capital, we've been pretty stingy with our cash. We've leveraged up these deals, whether it's bank financing, vendor take back or seller note, earn out structure. In one case, we issued shares, but our dollars have gone a long way, and we think we can get really good returns on those dollars. So we like those, in terms of how we deploy the capital. There are larger transactions that we could do. We've looked at those, and I think we'll likely do some of those, in the future. But I think if you look at where we've come from, which was literally just a concept, to what's $1 million of revenue at the end of 2017, and 10 million at 2018, and 17 the last couple of years, we've been a really small business, and certainly as a public company, a tiny public company. And so I think from a risk profile perspective, we've made sure that we've taken on the appropriate size of business for us. And it was important for me, certainly, to be able to demonstrate to the market that we could run these businesses well, and that they were good investments. And I think we've done that. So I think as we continue to grow, I think it does make sense for us to look at larger transactions if we think the return will be there. And if we think that it's in a good location and we've got a good operating team in place locally, then we can do that. But again, I think these smaller businesses will always be part of the strategy going forward.
And on the smaller businesses, what kind of synergies are involved in there? Is it just some cost rationalization, or can you add some, let's call it professional sales and marketing to grow the market? How do you what multiples do you buy it at, and how much growth can you add to these small operators?
Yeah, so really there's two separate parts. There's a synergy part, which is just the expense side, and then of course there's the growth aspect of it. And so I'll tackle both. One, I mean, we've been buying these businesses between 3.5 and 5 times EBITDA, pretty consistent. I mean, if you look at all our transactions, which we've announced, I mean, they're all pretty consistent from a valuation perspective and a deal structure perspective, for the most part. And again, the way we finance the deal is pretty similar. So if we look at if we start at the income statement, perhaps you take a look at the revenue, and there's really 3 ways for us to grow that. One is we can increase the billing rates. We do have pricing power, which is one of the benefits of being in the private pay space as opposed to Medicare or Medicaid, right? So we have pricing power, and we can adjust the price depending on the market conditions. 2, we can look and increase the hours of service, because we're billing on an hour of service basis. And one of the things we've just done recently is invested in digital marketing associates. We have someone now that's looking at that side of the business. None of these businesses have had that skill set in the past. It's all been word of mouth referrals. So we are investing in that. And then 3 is to take that one business and then to go into another location and just open an organic location. So those are really 3 of the ways we can grow from a standalone agency that we acquire. On the expense side, we're billing on an hourly basis. We're paying our caregivers on an hourly basis. So we make margin every hour. And that's generally been between 33.5% to 35%. Again, pretty consistent on a quarter to quarter basis. Not a whole lot of variation there. So that there's no synergy there. I mean, it's a matter of our job is to meet the market demand. So then once you start getting below the gross margin and you move towards the EBITDA line, then that's when you start looking at, we have consolidated the back office functions. So we've overlaid a technology that's primarily for us as a scheduling technology, which is critically important for us, ties into our billing, payroll, and accounting functions. And we've consolidated the accounting team here in Halifax. And so it used to be we look at an agency and they may have one accountant that was paid, let's say $50,000 a year, but they could only be busy 2.5 days a week. And so it just didn't make sense to us that was not an interest to us. That seemed to be a bit wasteful, as good as the people were, like as nice as they were, that didn't make sense economically. And so we now take that same person and put them out over 2 or 3 agencies. And so you're just spreading the cost over a larger base. And then, we look at workers' comp rates and we look at general insurance rates. We do get some buying power there. But generally it's around the back office functions, the overlaying of technology, the improvement of processes. That's where we get the synergies. And then again, we look to invest in those agencies on the digital marketing side and some traditional marketing to grow the revenue side.
And when you buy these business, like the care workers, are they contractors? Are they employees, or how is that side of it structured?
They're employees.
They're employees.
Yeah.
And they're not on a salary. They're on a sort of a variable, how many hours shifts they pick up, and they get paid per hour appropriately.
Exactly.
Okay. All right. You mentioned like the private versus Medicare. You guys are in the private side of it, so it's all out of my pocket, or the kids of the parents who's being taken care of, they're just paying directly.
I think you can break down our revenue 3 ways. One is private pay, which is out of pocket by the seniors we provide service to in the home or their adult children, depending on who's picking up the tab. And the other 2 parts of our revenue mix would be veteran affairs. So the VA in Canada or the US. And so those are obviously government reimbursed programs. And then the third bucket would be long-term care insurance. So some individuals are covered that allow them to get care within the home, and the insurance will cover that. And typically there may be, let's say, a list of somewhere between 5 to 7 things that they and they can meet maybe 4 of them to get the coverage. So every policy is a little bit different, but that's the other bucket as it relates to our revenue mix. So those 3 things. But private pay makes up about 70% of it.
Okay, and there's no Medicare, Medicaid sort of government kind of stuff in there.
We'd have a little bit of what's called Medicaid waiver, but it's trivial in our business. We don't do Medicare.
All right. And I'm looking at the map over your right shoulder there. You've got a few dots in, I guess that's Nova Scotia or in Canada. And is that pretty much the same? Obviously, they don't have, like, how does the Canadian operations differ at all then from the American ones?
Good question. Not a lot. In terms of the care that's provided, it's the same, whether you were here in Nova Scotia at 3 locations we have here, or whether you're down in, Vermont or New Hampshire or Oklahoma or Arkansas. I mean, the type of work that we do within the home, particularly with dementia, those that live with dementia, I mean, it's the same type of work. So that's the same. The billing rates are pretty much identical. They may fluctuate depending on a little bit location, but they don't vary greatly. I'd say the one thing that people will notice that have been following us, and certainly our financial reporting, is that we had record results in Nova Scotia, And if you think about where we are from a COVID perspective, certainly Nova Scotia has done very, very well. I mean, certainly one of the leaders, not just in Canada, but in the world, from a case perspective. And obviously the US was hit pretty hard, and we generated about 80% of our revenue out of the US.
And so how has COVID been impacting the home care service? People don't want caregivers coming into the home, or how does it all get impacted?
If we look back at 2020, it was a little bit different depending on the quarter.
Yeah.
We'd entered 2020 in really good shape. I mean, we had I think record results. They're going into the start of 2020. Tail end of Q1, we started to see the impact of COVID. Certainly felt it into Q2. Q3, we started to see a rebound, which reflected in our results. And then again, saw a bit of an impact in the second wave, but primarily in the US. Again, our operations in Canada, given where we were in Nova Scotia, weren't really impacted. I mean, it actually did quite well. So, we were definitely impacted. I think we managed our way pretty well through the experience. I mean, it wasn't just, yes, there may have been some of that where you had some folks that didn't want somebody in a home, but you could have schools closed where you had a caregiver that had to look after their children at the house. You certainly had some government policies that were in place that I'd say incentivized people not to work. There actually continue to be some policies, I think, in the US that are of that nature. And then you'd have just normal health and wellness in terms of if somebody had a potential exposure, what do we do if they have symptoms? They can't go in the home. So a number, I think, factors that would have had an impact on us, in 2020. But again, there was a bunch of government programs that also helped companies like ours. We benefit from some of the programs in Canada and certainly in the US. So as much as the revenue was a bit flat, I think we did a pretty good job in the balance sheet, put some cash in the balance sheet, paid off some debt. And then I'd say towards the latter part of Q2, really into Q3, we were pretty active back in the market from an M&A perspective. And we closed 3 deals in the last roughly 6 months. And again, have a 4th that's been announced in September. So again, flat for the year, slowed us down certainly for a quarter or so, but we've been pretty active since Q3.
You mentioned on the acquisition from September that there are some licensing issues associated with that. Could you talk about the whole, is it a sort of a regulated licensed industry or business? Is that state by state or county by county, or clarify that?
Yeah, I'll clarify. There are no issues. It's just a timing process. So every state's a little bit different. Some have license processes or license requirements, some don't. And in one particular state within New England, there's a license process in place. And I would describe that process as antiquated, maybe being too fair, to be honest. It's one of those situations where the Department of Health there maybe just hasn't invested a whole lot in technological processes. So a very manual type process. And so as a result, it takes a bit of time to get through. So again, not an issue. We've had this experience with this particular state before, and so we sort of expected it.
All right. And on the actual caregivers, are they, I don't presume they have to be registered nurses or anything. What kind of qualifications do you have to get for someone to work in that situation?
Yeah, I mean, we have registered nurses for sure. And some of the registered nurses look after our locations. They may be the leader in a particular location. We have licensed practical nurses as well, which again, depending on the state, there's different acronyms, but CNAs, so certified nursing assistants, or continuing care assistants, depending on the location. Again, those are diploma-based programs that would be, post-secondary. And then we would have individuals that understand responsibility. Maybe they don't have formal training, but they have training in terms of raising their own family and looking after folks, want to give back to society. And those are perfect fits for us from a caregiver perspective.
So so there's no mandated regulatory that a caregiver has to have a diploma or anything else for them to work there?
It would depend on the state and depending on the nature of the work that they do.
Okay.
So yes, depending on the state, there may be some regulations that require, for example, CNA as opposed to somebody that doesn't have
Yeah.
that diploma. Yeah.
Yeah. We have at-home care for my father, and we found that whether you've got you're a registered nurse or it's more personality dependent. Like there's not that much complexity to it. It's like, do they pay attention? Do they have a good heart? Do they care? And do they work hard? Those are sort of the main things we found on it.
Yeah, it really comes down to matching the right personalities for sure. I mean, you hit it. I mean, there are registry models out there, which, you just go online, you pick somebody, they show up at the house and you hope for the best. And
Yeah.
that's not our model. We don't have an interest in that type of model. For us, it's really about making sure that we're providing the dementia training to our caregivers so that we're giving them tools or techniques that are different than what they've learned in the past so they can be better at their job when they're dealing with folks that live with dementia. And then matching up the personalities. I mean, some family situations are much more difficult than others, and we've seen a lot out there. And so we would, in a more difficult family type situation, we'd put a more experienced caregiver in that type of situation.
Okay. You mentioned non-franchised model. Is there? I would think this makes kind of sense. That are there a lot of franchise type models out there as your competitors?
Yeah, lots of franchises. Home Instead, you're out west, so you'd probably be familiar with Nurse Next Door.
Yeah.
There's a number of them. Visiting Angels down in the U.S. First Light. Yeah, there's a bunch. From a purely competitive perspective within a market, generally a franchise would be or two or three franchises would be the main competitors there.
Okay. All right. And let's hopefully sooner than later we go back to a more normalized non-COVID world here. How many acquisitions, like how big is your management team in that? How many acquisitions could you pull off a year of, let's say, the $1 to $5 million? Or how many millions of dollars of revenues do you think you guys have the capacity to acquire annually?
So I'll say that the size of the transaction probably doesn't matter that much, because it probably takes just as much time to do a smaller deal as it does a larger deal.
Yeah.
Um, Lots of reasons for that, but essentially the due diligence process is the same. We have the same due diligence team. We're looking. It's all the same, one deal to another. So size probably really doesn't have much of an impact. But with the current capacity of the team, we could do 8 to 10 in a year. That's about where our capacity would lie. We did just add a research analyst to the team, which has been really good for us. And so, our plan is to increase proprietary deal flow. So you think about there's like 4 main ways that we would generate deal flow. One is direct reach out. 2 would be brokers come to us on a regular basis because they know that we're a good buyer. 3, there's a couple major conferences we would normally attend, and 4, the sellers would typically may refer part of their peers to us if their peers were looking for an exit. So those are the 4 main ways, with the 2 predominant ways being direct outreach and brokers. And so we've increased our capacity for direct outreach for sure. I'd say within the last probably 3 or 4 months, I'd say, and results been really good to date. So we're quite happy. But 8 to 10, your original question, we could do 8 to 10 a year with the current team.
All right. And are you just like, you can see there's sort of a stripe going there from, I don't know, a little north of Texas, it looks like, to Nova Scotia there. Are you trying to build sort of a hub and spoke type model, or have areas of concentration, or in terms of going into new territories, or are you trying to find acquisitions that are adjacent to existing locations? How do you do that? That's more kind of organic growth.
Yeah, I mean, there's two ways that we look at a geography. One is, we certainly plan to go deeper in the areas where we already are. So if you sort of go back to our history in 2017 and 2018, we'd made 7 acquisitions in that span. I think over a span of about 14 months. And we're Nova Scotia, Vermont, New Hampshire, Rhode Island, Massachusetts. And the model that I like is having three agencies that are overseen by one regional director. That's really the model that we strive towards, and we have that model, in Massachusetts, for the two states in Vermont, New Hampshire, and as well as Nova Scotia, and then we haven't quite added enough capacity yet with additional either acquisitions or startup locations in four other areas. So Oklahoma, Arkansas, Ohio, and Rhode Island. So we continue to look in those areas for additional opportunities. And so, I expect that we'll add either acquisitions or startup locations in those areas in the years to come under that type of model. We know that if, sometimes we reach out and we're looking at going into a new location from a startup perspective. So we'll reach out to current owners, say, look, we're coming in this area. If you have an interest in a partnership or an exit, just sort of let us know. And sometimes that will actually lead to an acquisition. And so what we thought would have been a startup location or organic expansion turns into be an acquisition. And so, which is good because we like those deals. It means there's cash flow, positive businesses, good staff, a good reputation, good local brand, which we keep. So, we'll do those deals, as much as we can.
So do you only open up a startup location adjacent to an existing one, or will you just go to a brand new territory and sign a lease and get going?
So we've opened one brand new startup location, which we did last April, and that was in Ohio. Yeah. And we've not been as active on the startup locations as a result of COVID, only because there's been some uncertainty whether or not you can actually get in to see people and, the face-to-face. So Ohio is brand new for us. We happen to have a really good individual that was working with us in Massachusetts that was looking to make a move. And so it worked out quite well for us. So he opened a brand new startup location last April. Now on Boxing Day, I don't know if there's anybody in the US here, because I don't think they know what Boxing Day is, but the day after Christmas, we closed on an acquisition in Ohio. So we essentially bought a competitor, but 40 minutes up the road. So that startup location has effectively turned into the acquisition of a mature business, and it's working out quite well. So again, just another way, just in terms of how we sort of evolved.
All right. You mentioned when you acquire a place, you maintain their branding. Can you talk about the branding? Is it Sue's Home Care powered by Nova Leap, or how or is it just their individual brand in each little area?
Usually just Sue's Home Care. Yeah, we've not put it is because it's not about us. We haven't put Nova Leap on anything. I see Nova Leap in terms of the folks that are in the Halifax, our M&A team and our accounting team and finance team. I mean, we're support people. We're support people to the local operators. That's really what we are. Again, accounting functions, back office functions, technology, M&A, strategy for sure. Those are things that we can help, bring to the table, but it's a local operator that's running the business, and, local staff, local brand. And I think the folks that we've inherited as part of acquisitions, they like the local brand that they've built. They felt part of a good business. I mean, these are feel good businesses. We're providing a great service to a local community, and they're not looking for a much, larger bureaucratic, type company to come in, which we're not. And so we do like the local brand. So the Sue's Home Care, we'd be happy to keep that. Now, there has been a couple instances where we have changed it only because I think in Vermont, New Hampshire, for example, we had two offices already. We already had a well-established, long-standing brand. And so we bought a small tuck-in business, which we did make the change. But I can only think of maybe two cases right offhand that we've actually made the switch of a brand, but certainly never to a Nova Leap brand, just to a local brand.
Yeah. And the size of these businesses when you buy them, is it some lady or a guy on his kitchen table with a cell phone and a notepad sort of scheduling people, or is it like they've got a little office in a strip mall somewhere, or what does that look like?
Well, that's probably how their business started, for sure. Yeah, I'm willing to bet if you talk to all the owners that we purchased from, that's probably a pretty consistent story. Most of the in terms of office footprint, it's a small office footprint. Usually no strip malls, but maybe in again, like a small rented space.
Yeah.
Maybe again, we're talking about like a footprint for 3 or 4 people, usually fairly reasonable rent. But the second part of your question, like the telephone and sort of manual scheduling and that sort of thing, even with well-established businesses, we've seen that. We've seen an owner that, or owners that have run their businesses for 10 or 15 years, and they're still on a manual process. So caregivers driving a half hour to drop off a manual timesheet, having to come into the office and pick up a check instead of a direct deposit. So those are things that we eliminate those manual processes, because so the caregivers are getting their direct deposit in the same schedule every week. It's going right to their bank account. They don't have to drive in to drop off a timesheet. It's all electronic. So we have all the technology to do that. So, I know in one of our businesses we acquired in New England, we took I think it was a 4-day payroll process, manual process, down to about 4 hours. So, big difference, right? So
Yeah.
as much as these businesses have been successful on their own, there's still, incremental improvements I think that can be made at each one.
Yeah. And with these businesses, what is the sort of the limiting factor on growth? Is it, because from my experience, it's finding good caregivers is really tough.
Yep.
Is it like if you could get a bigger pipeline of good caregivers, you could add in all sorts of more clients, or is it sort of a bit of a balance, or is it just tough finding clients?
No, it's just caregivers, access to good caregivers. That's it. Like, I mean, I could stop there with my answer. Literally, that is it. That's our barrier to growth. There's nothing else.
Okay.
The demand for the service is there. It'll always be there. You think of demographics over the next 50 years, it'll be there.
Yeah.
It's just based on demographic. You have people that are aging and they have a chronic condition, long-term health issue. They need help. Demand is really not the issue. From a growth perspective, as a barrier. The only barrier I really see is access to good quality caregivers. That's it.
Yeah.
That's really the barrier.
Yeah. And I just want to say, in the audience out there, if anyone on the Q&A want to type in a question for Chris here, please type away, ask a question if I've missed something, or something you want us to drill down upon. Could you talk about your competitors, those bigger competitors, and like, do they have a big sort of corporate brand, or how do they go about their business? How are you sort of, your operations differentiated?
Most of the competitors at a local level are getting franchises, so it's a locally owned franchise.
Okay.
That would be our competitor. So the large corporates that are, so I've not yet found, and no one's been able to find me a direct comparable to Nova Leap Health Corp in terms of rolling up private pay non-medical home care companies. We haven't been able to find one. The closest public companies in the home healthcare space have been the LHC, the Amedisys, the Addis, the ones we put on our deck on our website and in the comp tables. But again, those companies are primarily focused on Medicare, Medicaid, and hospice, right, which are government reimbursed type plans. And so that's just at sort of the capital markets level, or who the larger consolidators are. We've seen some private equity investment in the space, again primarily in the home health care space, so the government reimbursed programs. But from a local level, in terms of providing the service, it's really a franchise.
Okay. All right. I'm running out of questions here. Is there anything we should that I haven't touched upon, or are you willing to make any kind of forecasts or kind of an outlook for the rest of 2021, given COVID and that, or any perspectives on what 2021 could be like?
Yeah, I mean, we've never been a company that has really put out forecasts. I mean, we put out, I think in a couple of instances, the number of planned acquisitions. And again, maybe it's the accountant in me of taking the perspective of really wanting to demonstrate our ability to do things as opposed to sort of talking about it. I'd say the vaccine rollout is positive for our industry. I mean, two things. One is, I think if you look at what's happened within facilities, that's negative in terms of what's happened to folks, but positive for the home care industry, because where's the movement? It's toward the home, where people are already within a comfortable setting, and don't have exposure to variants and so on like they may in a facility type setting. So I think our industry is certainly well positioned, and I think the vaccine rollout is great for us. So again, we were pretty active at tail end of 2020. We continue to be pretty active in the M&A front. So my expectation will continue to grow from these levels.
Yeah. And is it like with the lumpiness you had last year, is it really when there's a second or third wave, business slows down, and then when things get opened up a bit, then business picks up again?
Yeah, it's a great question. What's been interesting is that, again, we have a lot of locations, as you can see on the map behind me, and it's been trying to figure out why some companies were impacted, some of our agencies versus others. You can really break down the entire industry, including our company, into three buckets. Some agencies that have performed really well. And again, we had record results in Nova Scotia, but we also had record results in other agencies in the US. Ones that were kind of like a break-even year, and then ones that, were down. And so we certainly fell within those three buckets as the industry did as a whole. But it's been, and just interesting that the ones that perform really well in the US, you look at that and say, well, that's, the best year they've ever had, but it was during COVID. And then others that historically have been fantastic businesses are still fantastic businesses, but aren't as high as they were. Difficult to kind of answer that question because I've been trying to figure it out. But certainly we've been impacted, no question, by COVID. But in terms of specifically why one agency versus another, it's been sort of tricky to decipher that.
All right, we got a question here: is how do you retain your best employees, reduce turnover, which you said is clearly one of your biggest challenges, keeping or hiring the good staff?
Yeah. I mean, I think one of the things that we've done, again, upwards of 70% of our clients live with a form of dementia. So it's a pretty high percentage of our clients live with a form of dementia. And what we've done is we've brought a specific dementia training program to the staff. And that's a program that really hadn't been made available to the staff before. So for us, I think, just having really good communication. And I think certainly during COVID, communication improved and increased. And I think we handled that fairly well. So staff always knew where we were, what we were doing from a COVID perspective. I think the dementia training to me has been key. Because when I talk to caregivers, when I go out in the field and I meet with folks in different states, the number one thing is they love the program. They love it, and they wish they had more of it. And so that's been key to us.
Sorry, love the dementia training program, or?
I love that program.
Okay.
Love the program because, again, you think about it, you're dealing with somebody who has dementia, and it's like the experience I had with our family. You have really, really nice people in there, and that's a start. It's great to have. You have to have nice people, but if you can give them techniques to deal with somebody that hasn't brushed their teeth in 3 days, or hasn't taken a shower, or having trouble moving around, or hasn't played the guitar in several years, and you could actually help them do that with certain techniques. That comes through training.
Okay.
Like that's through training, and we, as in Nova Leap, as we acquire these companies, we are bringing that training to the staff, and that's been I think that's been pretty rewarding. So that's been key to us. But if you look at the surveys in terms of what they want recognition, good communication, a good manager matched up with the right family, and then obviously want to be rewarded appropriately for that.
Yeah. All right. I think this has been pretty in-depth. Is there anything we missed? We should probably start wrapping things up here. Any sort of final comments or any things to point out?
I don't think so. I think you've covered it pretty well. I mean, you've known the story for the last few years. And I talk about this in other spots, but we're a pretty consistent business, pretty easy business to understand. I think, from an investment perspective, from my perspective, we're just getting started. We got a long, long runway. We'll be doing this for several years to come. So I feel pretty good with where we are.
All right, Chris, thank you very much for taking the time chatting with us. We appreciate it.
My pleasure. Thanks, Martin. Take care.
Cheers.